and connect people in the know. I'm Margi Kyle, and today our guest and program is sponsored by Coco Couture, your premier destination for women's upscale fashion, right here nestled in the Lake Norman area. It is a pleasure and very dear to my heart to introduce our person of the know this week. Lindsey Hendrix, Director of Outreach and Education for Carolina's Caring Hospice and Palliative Care. Welcome.
Thank you so much for having me, Margie.
I know
It
with
is,
little smiles, I've worked with hospice. Um, you all have been so wonderful to our kids that are having problems. So today we're going to talk about Carolina's Caring Cardinal Kids program, and I'm wearing proudly my Cardinal.
oh,
Beads of Courage. Tell me a little bit about this program because it sounds outstanding.
yes. So, Beads of Courage is a tool that we use, one of the many tools that we use, not just to support our medically fragile patients at Carolina Caring, but really to support their whole family. So, with Beads of Courage, and I actually have mine on today as well. Um, Not just the child that is facing, an unimaginable disease process, but their entire family gets to participate in this very, very special program where every obstacle that the child goes through, every hospitalization, every stick that they get from a shot to any anything that they have to go through within their disease process, they get a bead that they add to a necklace that signifies the courage and the strength that they have to face this disease process or this medical complexity that they're faced with. Um, and a very special thing about Beads of Courage is the beads are not just given to the patient, the beads are also given to the parent.
It's a family
For
affair.
Yes, absolutely. So, like for the mom that is, sometimes sitting with these children in the hospital, for 30 plus days, they are getting beads for the courage and the strength and the advocacy that they're showing to their child. And also the siblings who, a lot of times these siblings are younger and they're facing all of these emotions
Yeah,
and feelings and it's not excluding them and it's bringing them into the story as well and saying, hey, listen, like you're going through not the same struggle as your sibling, but you're also going through a
yes.
struggle and you're brave too. And you have these beads to show, oh my gosh, like these are your warrior beads, like you're strong. And it's just so special to be able to meet the whole family. And when we go through and say, oh my goodness, like, yes, we are so glad that hospitalization was over. We're so happy to have you home. But look how strong you are. Look at what
Yeah,
you overcame. And it turns for the child, for the sibling, and for the parent, psychologically, such a traumatic event into like a symbolism of how strong, like their
yes,
strength.
yeah. Well, and it helps them to realize they're not alone
Absolutely,
because it
for
is the
sure.
loneliest feeling when your child's in the hospital, or yeah, there's no worse feeling for a parent.
Most definitely.
Yeah,
Most definitely. And, every visit. I don't think I've been to one patient visit that I've not been shown beads of courage. We have two of the most beautiful twins on our services. Well, one of them is on our services, one of them isn't. And every time that I've been over to see little sister or sibling sister, the other sister will always come and sit on my leg and she'll say, "Oh my gosh, look at my beads." She's like, "I can wrap them around my neck twice." So just the strength and how proud she is versus, "Oh my gosh, like my mom was gone for 2 weeks. I feel excluded from this journey."
Yes, yeah,
It brings the family together.
absolutely. So if people want to help, how can they help?
So, if people want to help, we actually have a program with our foundation, the Carolina Caring Foundation, where for just $1,000 a year, individuals can actually support Beads of Courage. So that actually pans out to like $3 a day, which I mean, that's less than a cup of coffee. Um, Yes, and you're actually supporting families. You're putting smiles on kids' faces. You're supporting the whole family, and you're actually supporting the clinical staff as well, because doctors and nurses, they're also giving these beads of courage as well. And working with clinically complex and sometimes terminal kids to a nurse that is bedside with patients, at end of life, those beads signify that their work is meaningful and it
Yeah.
changes lives, and it's very special to the clinical team as well. But
So I
yes,
guess if
so
if somebody doesn't have $1,000, just donating beads would be great too.
absolutely. Or even, on Carolina Caring, on our foundation website, it
And what
is
is your
very,
website?
so our website is carolinacaring.org.
Yeah.
You can go on the website and you can go to our Carolina Caring Foundation webpage. And there is a spot where you can scroll down and donate to Cardinal Kids. You
Okay.
can also specify on there Beads of Courage. So even if it's not $1,000, even if it's $10, and you want to donate that portion towards Beads of Courage, you can even donate it in memory of someone.
Okay.
And that money will go directly towards funding our Beads of Courage program.
I commend what you're doing. There's such a need, unfortunately.
There
And
is, and with pediatric hospice, it's a concurrent care hospice, and that's something that I'm excited to get into with you at a later date. But with the concurrent hospice plan, we have the privilege of not making our patients choose between comfort measures and curative treatment. So we can be advocates for our little people throughout the duration of their fight with whatever they're fighting, and, try to help them eventually get to a place where they can graduate off of services.
well, I commend you for what you're doing. It's amazing work. And we're here to help you any way we can.
Well, thank you so much. And it is just a pleasure to be able to come and raise awareness to Beats of Courage.
Yeah. If you're somebody that we need to know, please feel free to email me at designingdoctor, that's DESIGNINGDR @gmail.com. And thank you for being part of our show this week. I'm glad I didn't miss it because I just can't wait to get out there and help you all. We're here
Thank
for
you,
your
Margie.
kids. Thank you so much.
Thank you.